We can talk about some of that backlog now with orthopaedic surgeon Professor Rob Middleton and Director of Breast Screening Lisa Bisset, who both join me here. Good morning to you both. Lisa, let me start with you. The impact on breast screenings across the hospital trust, what has that been like during this pandemic?
Well, we stopped screening in March of last year, reluctantly, when the numbers were peaking, and so we weren't screening for several months. So that meant that some of our staff were redeployed to other areas, and we're all now back and keen to be working on that backlog, but it is a mountain to climb, so we're thinking of different ways now that we can address that backlog and get to our patients quicker.
Talk me through some of those, because some of them are quite innovative.
Exactly. So the Think Big project means that we can think about working in different ways. We've been working with teams across the trust, sharing ideas, solving problems, and just thinking about how to do things slightly differently so that we can get to those patients quicker. So by having somewhere that's open more flexibly than a hospital site would be, that is separate to our everyday normal working, means that we can get through more patients.
So, we're going to have breast screenings effectively, for instance, in the Dolphin Centre in Poole.
Yeah, possibly. So that means that we can give our staff options of working overtime, working different sorts of shift patterns, again, thinking things out of the box. And it's really exciting because it means that we can actually try out different ways of working, and some of that may stay for the long term.
There's a couple of things in there. One, I guess, is the concern about patients' health and well-being, because while we've seen this dreadful toll from the pandemic, your concern being involved in breast screenings will be that those patients who've missed regular screening appointments, that might be another serious health impact to come in the coming months and years.
Absolutely. Within that population of people that are waiting for their breast screening, clearly there are going to be some breast cancers that we haven't yet got to. So our main aim is to get to those people as quickly as possible.
And what about the staff aspect of this as well? I mean, we hear about it having been a tough 18 months for NHS staff generally, I guess predominantly front-line staff facing the pandemic. But with your team in breast screening, I know they've been redeployed during the pandemic, but you've been aware that at some point we'll get a handle on coronavirus, and this is now going to be your kind of eye of the storm.
Exactly. So actually breast screening had a very quiet period where, as you say, staff were redeployed. Now the whole team is back together and quite excited by getting on top of this backload and getting to our patients as quickly as possible. So our mountain to climb is kind of now in terms of breast screening, whereas previous specialties, like the frontline staff, they've hopefully been through their worst of it, but we are in it now.
Let me come to Rob, as I say, who's in orthopaedics, and I guess a similar kind of story with orthopaedics, Rob, that a lot of these conditions are treated with elective surgery, and that has been, we've heard many times, been significantly paused during this pandemic.
That's correct. All our staff were redeployed really for 5 or 6 months to help the frontline staff in A&E and do emergency surgery. But we're now back working full-time at elective work, and those lists are starting to come down quite significantly.
What can you do to get through that backlog more quickly? Lisa can and her team can have these, say, screening clinics in different places and work more flexibly. I guess if you're doing surgeries, there's only so much flexible working you can do, and it has to happen in an operating theatre.
That's correct. So we're drawing up extra resources. We're continuing to use the independent sector for NHS patients, but also as part of the Think Big project, we're looking at bringing in new facilities. So if you visited the Royal Bournemouth Hospital today, you would see it's a huge building site. So we're building those new theatres and wards for the future. And also we're looking at mass clinics where we can provide better treatment for patients, but in a much more timely and efficient way. So one of the key ways is we're looking at the IT and the digital transformation that's going on. So we're confident that as the waiting list went exponentially up in the last year, that we can get them to come exponentially down.
And do you have, this is a big question, I guess, a sense of when we'll return to pre-pandemic levels of wait times?
It's really difficult to say because it depends on coronavirus. If it disappears and goes down, then I'm confident in the next year we'll be in a really good place. So I temper it by saying that, but what I can say is these projects are going to happen in months, not in years. So although we're planning for years ahead, things like the big clinics in the Dolphin Centre and things, we would expect big announcements to be made over the course of the summer about those. So even in 6 months' time, I think we're going to be transforming the landscape on getting elective surgery done.
There's so much we could talk to you both about this morning, and we'll talk to all of our guests about over the course of the next couple of hours. We're going to hear from the Prime Minister later on today about coronavirus restrictions easing on the 19th of July. I won't put you on the spot about those necessarily. I do just wonder, Lisa, on this 73rd birthday of the NHS, can you talk to me a little bit about your feelings of working for the organisation? How proud do you feel to be part of it? What kind of an impact has it had on your life?
My goodness. Personally, my son was very poorly when he was born. He was very premature, so the NHS I owe a massive gratitude for on a personal level. But certainly over the last 18 months, I'm so proud of the colleagues that I work with. Without even question, they were all redeployed to very different areas to what they're used to working in. And I've seen such great attitudes to work and for working for the NHS, and there is a sense of pride certainly amongst colleagues for what they do every day, and appreciation for our colleagues throughout the NHS as well.